the baby is going to need things too. And this is sort of a really new territory for you. You're not used to necessarily packing for another little person. And so you will take lots of pictures during your hospital stay of this baby, right? So obviously the baby's going to have a million pictures taken in the first couple of days. You will also likely have a professional photographer come and offer to take pictures of your baby. Definitely have things that you want the baby wearing. I wouldn't go crazy. You really don't need more than 1 or 2 outfits. And one of those outfits can be the baby's going home outfit. Just really things that are easy to put on and off. You're really just getting used to taking things off to change a diaper and doing all those things. So keep it simple. And remember, you're going to have these pictures forever. So whatever you want them to be wearing, just put it in the bag. I think that some sort of a nursing pillow is helpful. You certainly can use the pillows that are in the hospital. You don't have to feel like you have to pack all this stuff if you're not sure. You can use a boppy. I liked the Breast Friend too. That was a good one. And they do help. The blanket and a baby cap, they will give you a cap probably at the hospital. But if you want like a softer blanket, something a little bit more cozy, then I would definitely bring one of those. Burp cloths, they also have those at the hospital, and it's totally fine to use them. It really depends on you and what your comfort level is. And some hospitals, I know we talked about this, Kim, that the hospitals still are providing pacifiers. A lot of the hospitals by us have gone what they call baby friendly. And in order to have a baby friendly certification, you can't provide pacifiers to newborns. And the idea behind the baby friendly certification is that to be breastfeeding friendly. And to be quite honest, I mean, I'm obviously very pro breastfeeding. I am a certified lactation consultant, and there are not great studies to show that pacifier use really affects breastfeeding. Bottle use, absolutely. So if it's something important to you, I mean, certainly you can deal with a few days without a pacifier if you just want to put the baby to breast every time they're fussy, which is what I would recommend. But if a pacifier is something that's important for you to have, just stick one in the bag just in case you will need it.
And to go along the lines of like new rules at hospitals, I know like going through the birth of 3 children, the whole baby cap thing has changed in the past like 10 years. Like you're supposed to keep a cap on their head, and then you're not supposed to, and then you are supposed to. So what are the guidelines nowadays?
So I usually recommend keeping it on in the hospital. And then, I mean, depends on when you deliver really, but if it's really warm out and you're leaving, you don't need it. If it's wintertime, of course, you want to dress your baby like you're dressed yourself. And, the head is where the baby's going to lose the most heat, which is why they do keep it on in the hospital. I mean, it's nothing you need to be overly concerned about if it comes off. I'm sure your baby will be fine. So just, try to remember that these things are guidelines and they're suggestions, and not to feel anxious if something isn't exactly the way we're talking about.
And then one more question that has come in.